Now, something else health-related now. A rise in allergies means 1 in 2 of us will have one by 2026. As it's National Allergy Week, expert Professor Adam Fox is here to answer your questions about food allergies today. Morning, Adam. Let's get straight onto it because Val has written in and she says, onions make me extremely ill. I know many people can't eat onions. Why are they not on the official allergy list?
So it's a really good example of where we have to separate out food allergies from food intolerances. Val's right, lots of people don't get on with onions, but for the overwhelming majority of those people, it's a food intolerance, which means it doesn't involve your immune system. So whilst it can be unpleasant, it's not dangerous. With food allergies, which are most commonly to things like peanuts and tree nuts, fish, egg, milk, things like that, there's actually a risk of a life-threatening reaction potentially. As a result, there's more legislation around that. And so, I think everyone is aware now that when you look at the ingredients list on packaged food, there's certain things in bold. The things that are bolded are on the list of the 14 most common allergens, according to the European Union some years ago, which is when the list was put together. So it's always a little bit strange to see things like celery and mustard on there because they're really not common allergens at all in the UK, whereas there's much more common allergens to things like kiwi or peas and lentils, more recent allergens that we see lots more of these days. They're not there. So it can be frustrating for consumers, particularly with those allergens. The Food Standards Agency is responsible for this list and they are updating it and they're looking at this so that hopefully it will better reflect going forward the most common allergens that we see for UK consumers.
Emma's been in touch to say she has a child with allergies. When they go to restaurants and are told the meal doesn't contain the allergen, there's often a disclaimer. You see this a lot. There's often a disclaimer that says it may contain traces and it's never 100% guaranteed. So how can people deal with that? Because lots of people do want to go out and enjoy a meal out. Should they take the risk?
I think it's further than that, really. What you've got to the real issue of reality of day to day for people with food allergies. Every time they pick up any food that they're buying anywhere, they have to have a really good look at it and make a decision as to whether it's safe for them. And the labelling laws help, but there's actually no regulations at all about the whole may contain thing. So it's entirely at the discretion of the manufacturers to put a may contain traces or may contain on. They don't have to. There's no rules about what they say. So some people wrongly believe that it's more dangerous if it says may contain traces than may contain, when actually they're just making this stuff up as they go along. So I always try to speak to my patients about what we call risk assessment. So making a decision about whether it's safe based on things that will affect a possible outcome. So this is something you need to discuss with your doctor because it's different for different individuals. But for example, for many patients with food allergies, if something says may contain, I ask them to think about whether they're well at the time, because if they're unwell, they're going to be more sensitive to what they're allergic to. Are they carrying their medication? Do they have their adrenaline injectors with them in case there's a problem? And can they reasonably expect help to come quickly if they were to need it? So if they're visiting friends in a rural Norfolk farmhouse, probably more important to be careful than if they're somewhere very close to where help will be able to get to them. And if you pull all of that together, you can start making sensible risk-assessed decisions. Otherwise, there's a risk of being really overly restrictive, which can make life much, much more difficult for people with food allergies.
So difficult. Catherine's been in touch and she says she has a nut allergy and has an EpiPen and she's been reacting to other things more regularly and she's been told she can have allergy testing done. But is it common to get more allergies as you age? And would you recommend paying for an allergy test online?
So it certainly can happen that if you've got one food allergy, you are more at risk of developing others. Most of that happens in earlier childhood. So most food allergies have developed by the time somebody's got to about the age of 5 or so, but it's certainly possible as they get older to develop new allergies. And remarkably, even adults who have been eating, for example, fish or shellfish for many years without any problem can suddenly develop allergies to it. So if you suspect something's changed, it does make sense to get retested. I would strongly urge against getting online testing done. Firstly, many of it is actually not scientifically validated allergy testing. It's food intolerance testing, which Dr. Ranj, you may remember on this program, did a really, really good investigation of. And they actually told him that he had issues with, I think, milk and egg, which he's eating all the time and is absolutely fine with. Even when you get the correct test online, though, it comes without the clinical context and interpretation that you need to make sure that you don't end up over-diagnosing yourself. So I would urge you to go to your GP. There's national guidance about getting access to allergy tests, especially if you've had a severe reaction. And if it's a child, again, there's clear national guidance about what tests should be done and when a referral is appropriate. And I think that's a much safer way to make sure that you get it right.
I'm going to jump in on Claire's question, who says not everyone's reactions to allergies are the same. Her daughter, who has a nut allergy, never gets a rash, but she does get a husky voice instead. Is it best to ask people what signs and symptoms there are so that you can be ready?
I think the short answer is no, because these reactions are inherently unpredictable. So somebody who might have, on a number of occasions, had what seems to be a similar reaction can then have a very different reaction in future. And in fact, there's a really unhelpful urban myth that's completely not true, that each time you have a reaction, it gets worse. And that causes a huge amount of anxiety. In reality, each reaction will depend on things like how much of it you've eaten, your state of health at the time, the form that the food's in, and there is a large amount of unpredictability as well. So really, it's just important to know what the features, the classic features of an allergic reaction are. And thankfully, most reactions are mild. And so usually it will be things such as an itchy rash around the mouth, maybe a little bit of swelling, and that's it. And the ideal is take some antihistamine, keep a close eye on things, and that's all that's needed. But it's also really important to be aware of the signs of severe allergic reactions, what we call anaphylaxis. And anaphylaxis is life-threatening and a medical emergency and requires urgent intervention. So if there's any suggestion of a reaction causing issues with your airway or breathing, so classically lots of coughing or a hoarse voice, or trouble with breathing, or anything affecting your blood supply or level of consciousness, so feeling dizzy or lightheaded or collapse in the extreme, then it's really important that you use the adrenaline that patient is carrying with them if they have it. That's number one priority. Lie them down. You can raise their legs as well, and make sure that somebody is calling for help. And when you call the ambulance service, let them know it's anaphylaxis. If you're not sure if a reaction is bad enough to use the adrenaline, then use the adrenaline. It's completely safe, and you'll never be sorry that you used it, even if it wasn't really necessary.
Adam, thank you so much for that reassurance. You know, 1 in 2 people, it's suggested, are going to have an allergy by 2026. So I know this is something we're going to be coming back to you and picking your brains on. Thank you for your support, as always. And just so much empathy to you if, you know, you or one of your children or family has an allergy.
Yeah, people are really struggling, as we just heard there. And for more information on what Adam's just discussed, head to the Morning Live website, bbc.co.uk/Morning Live.
Well, we just